Happy New Year, NAAOP members and friends. It's Peter Thomas in Washington, D.C., General Counsel of the NAAOP, National Association for the Advancement of Orthotics and Prosthetics. As we near mid-January, I wanted to bring you an update as to what's occurring in Washington, D.C. and the impact that deliberations in Washington are having and expected to have on orthotics and prosthetics. We left last year with the Congress passing a 2-month extension of the physician fee schedule, which essentially means that a 27.4% cut was not experienced by physicians who provide care to patients under Medicare the first of this year. Essentially what Congress did was kick the can down the road, and for another 2 months until February 29th, the physician fee schedule under Medicare will be held at essentially where it's being paid, where it was being paid in 2011. And the Medicare therapy caps exceptions process will continue as is, meaning that Medicare beneficiaries who receive outpatient therapy services will be able to receive services over the cap that's in place if they meet the exceptions process, and most of the patients under Medicare who need those extra services do meet that process. That means that as Congress returns over the next week and a half to Washington and the President prepares to give his State of the Union address, there is going to continue to be significant discussions and negotiations to figure out how to extend the physician fee schedule fix and the therapy cap exceptions process for another year, and to offset that with certain Medicare cuts and reductions in spending so that those fixes do not cost the federal government any money. There's also, of course, the added difficulty of trying to negotiate and figure out what to do about unemployment insurance, as well as certain tax provisions that impact the Social Security Trust Fund and have caused some controversy as a result. The fact is that over the next 6 weeks or so, Congress is going to be hard at work trying to figure out how to extend these provisions without costing the Medicare program money. And ultimately what they're going to have to do is offset those provisions with other spending reductions in Medicare that could impact O&P, DME, other kinds of providers, hospitals, and others that function under the Medicare program. So we'll be watching very closely, continuing our advocacy and monitoring and making sure that O&P gets a fair shake in that process. We'll also try to take advantage of any opportunities there may be to try to move forward the orthotic and prosthetic legislative agenda. And of course, we'll be working with the Secretary Sebelius and the Department of Health and Human Services on a whole other issue known as the Essential Health Benefits Package. The Essential Health Benefits Package is something that received significant guidance from the Department of Health and Human Services, which they published on December 16th of just last year. There's a new comment period that is available to anyone who wants to comment on this guidance. The Essential Health Benefits Package is the package of benefits that every private health plan will have to offer individuals in 2014. When healthcare reform goes into effect, if it goes into effect, based on what the Supreme Court does with the case later this year, and based on whatever the outcome of the election is in 2012. But ultimately, the Essential Health Benefits Package is a package of benefits that all health plans are supposed to carry and that individuals have access to. And that benefit includes rehabilitative and habilitative services and devices. We expect that orthotics and prosthetics will be included in the Essential Health Benefits Package, but the guidance that the Department of Health and Human Services put out in December did not make that clear. What they did do was tell states that they should be referring to a benchmark plan, and they allowed states a fair amount of flexibility to choose a benchmark plan based on, for instance, what the largest small employer plan in the given state would be and what benefits it would contain and cover. In many instances, orthotics and prosthetics fares pretty well under that scenario, as we currently know. We are doing additional research into this. There's others in the O&P field who are working hard to try to quantify what the O&P benefit is under that new scenario that HHS is proposing. But ultimately, you should know that the O&P field, NAAOP included, will be submitting comments by the 31st of January and 30th of January, which is the deadline, and ultimately will be making a spirited case for coverage of O&P services. It's another busy year in Washington, D.C., and we'll continue to try to keep you updated through these webinars and through our website, NAAOP.com. Thanks so much.